And I was in shock because I could move. I didn't have to manually pick up my leg. And I woke my husband up and I said, my leg moved. And he's like, it's 4:30 in the morning. I said, I don't care. My leg moved.
Okay, I'm going to go walk around.
You're starting with your heart.
I had a heart attack back on, it's been almost a year now, February 16th will be a year. And I was going through cardiac rehab, and I was having some left leg issues, primarily around the knee. And they had suggested that I take magnesium, but it wasn't getting better. And then, of course, I was worried that maybe it was blood clots. So went to my primary care doctor, and they ran an ultrasound on my leg, and fortunately didn't find anything. But I was still in pain, so I thought it might be I'm on a statin from my heart attack. And so I'd read that the statins a lot of times will cause joint pain. So I thought it was the statin, so I took it upon myself to go off the statin.
I remember you came in, you're like, I started back 2 days, but I tried.
But the cardiologist didn't feel like it was the statin. He suggested I see an orthopedic doctor. The problem with the orthopedic doctor is he wanted to give me muscle relaxers. And all that did was make me sleepy. So it wasn't curing anything. It was
the
just
naps are great, but they don't necessarily help.
And I was worried because being a muscle relaxer, your heart is a muscle. So I was concerned about that.
There's a lot of complicated factors going into that with the heart attack and everything. I feel like it was a scary process as to what was going on, in my opinion, when you came in.
But I think I told you, like when I would try to get up in the morning to just even go to the restroom, my leg would be so stiff that I would have to physically move it. And then to sit down and actually use the restroom, my leg would have to be extended, and I'd have to finally just force it to bend, which would cause excruciating pain. And going upstairs was a nightmare.
How long was that? How long was it that severe, I guess I would say?
Let's see, I had my heart attack in February. I went and had the ultrasound in March, and I believe my first appointment with the orthopedic doctor was in May, and I think I went to him twice before I came to see you, so it wasn't...
a couple months. A good long...
And it got progressively worse. So I mentioned going to the orthopedic doctor, and he had said, like, we can suggest physical therapy, but you're already in cardiac rehab, because I was still doing cardiac rehab until like early or mid-May. And it wasn't getting any better. It just
with no answers as to why.
And I think
that's the most frustrating part.
I think I told you, like, I'd see other people crossing parking lots, like, and they couldn't have been much difference in age than I am, and I thought, that's going to be me if I don't get something done.
It was on its way, and it was not having answers. I feel like is the most frustrating part, especially when there's no relief plus no answers as to what's going on.
And everybody wanted to suggest something. Maybe it's your sciatic nerve. Maybe it. My daughter, who is a medical device representative, and her husband are very into being healthy. And my daughter, I said, well, maybe I should go see a chiropractor, but the only chiropractor I'd ever seen was an upper cervical doctor. And I said, I just don't feel like that's going to solve my problem. And she said, oh, you should go see a doctor that specializes in art. And I'm like, painting?
Art?
You mean art? And she's like, no, it's like
ART.
What is it? Active
release technique.
So her husband had been to a chiropractor that specializes in art. And so he actually went online and looked, and he's like, oh, there's one just right over in Kennesaw or Villa Rica. And he talked about Dr. Mims, and I said, okay, I want to go check it out.
At that point, it's like, nothing's going to hurt, When she came in, it's very complicated, as we've kind of covered. You had all the things going on and had really no idea what was going on. So what we'd like to do here is kind of revert back to looking at the body as a whole, how it moves, what could be causing the pain related to how you move, or what could be off, So we did the SFMA functional movement assessment. So kind of watching how everything is working together, because with her, it was mainly posterior thigh and knee calf pain was the big thing. Difficult to walk, all the things. So of course, in that kind of scenario, all the tests are positive because everything hurts. So that's what makes it fun. So with that, it's kind of trying to figure out why. Was it tight hamstrings, tight calves, both where they cross the back of the knee? Is it a pelvis position problem? Is it a core problem? Is it all of the above? So with her, a lot of the initial treatment was basically just active release technique. You can't do a lot of forceful adjustments and manipulations with someone that's in that much pain, because it's not fun for you right at first. So she came in, I went through, her calf and hamstrings were very tight, pelvis was very anteriorly rotated, pulling on the hamstring, so we kind of just reset all of that. So we went through calves, hamstrings, pelvis, trained some core stuff with her, and then you had some initial relief the first day. I remember this, you always mention this. I told her, I was like, you're going to get some initial relief, but over the next 2 to 3 days, it should gradually get better. She's smiling because this is, I think you also wrote that in your Google review. And so she was like, skeptical. She was like, okay, well, initial relief was about, what would you say, day 1?
It's embarrassing, but I'd say probably only like a 10% relief.
Yes.
But you said by day 3.
I was like, just trust me on this. Just trust the process. And that's actually some of the research on ART is they continue over the next 2 to 3 days to continuously relax and, work how they're supposed to work, which is the goal, obviously. And then the next week she came in Tuesday, bright and early, 7 a.m., crying with a card in her hand. And it was one of those days that you're like, my job has a purpose. I did something well here. So,
yeah, that was the on the day 3, which was a Wednesday, because I'd come in on a Monday. I woke up at 4:30, and I just got out of bed, and I was in shock because I could move. I didn't have to manually pick up my leg, and I woke my husband up, and I said, my leg moved, and he's like, it's 4:30 in the morning. I said, I don't care, my leg moved.
Okay, I'm going to go walk around. That's her favorite part of all of it. She's like, yeah, I'm waking him up right now. It's great.
You came here starting with your heart.
I'm able to carry this baby around.
The most important part.
Yes. Yeah, without the help that you've given me, there would have been no way. I would have just had to tell my daughter I can't care for her, because I just couldn't lift her and try to move around, not comfortably knowing that I could fall.
Yeah, I feel like that was the biggest thing, is the confidence in moving around and not being, scared to hold the baby or scared to carry your stroller around and things like that.
Exactly.
Yeah, she's now on the maintenance side of things. So every 2-3 weeks she'll come in and we basically chat about life. And at this point, we're close pals. But just keep everything in order for her, so that way it does not come back, basically. And yeah, she came in today. I said, how you feeling? She said, I have 0 complaints. I was like, that's a win.